This is Joy News Prime with me, Samuel Kojo Brace. In our headlines, there are multiple cases of measles reported in the Tamale North constituency as 3 members of a single household are reportedly showing symptoms. Member of Parliament for the area fears schools may be closed due to the outbreak.
The Tamale Central Hospital had to shut down the pediatric unit because of the outbreak of measles. And if care is not taken and this addressed aggressively, we may see the shutting down of schools, very soon.
More as Parliament's Health Committee demands the Ministry of Health account for more than 71 million cedis paid by the NHIA for supply of essential vaccines. Also coming up, Ghana demands experience, not experiment. Former President John Mahama has officially launched his campaign bid for re-election.
I've searched my soul and placed close attention to your voices, to your daily struggles, and to our present national predicament. At this stage, Ghana demands experience, not experiment.
More as NPP MPs taunt the former president after he launched another bid aimed at taking the presidency. Also, city authorities evict heavy truck drivers parked dangerously close to the Tema motorway, barely 24 hours after we reported that residents and commuters were concerned.
Parking place is small, but from there to the Bognaza there, if they're not parked there, it's good because that place is causing big accident to take over this situation for toll booths here. People was die here is plenty people.
Now, there are reports of multiple cases of measles in the Tamale North constituency of the northern region as the acute viral respiratory illness spreads. MP for the constituency, Alhassan Sohoyeni, has expressed worry about the situation and called for immediate action. Yerafa of our affiliate radio Justice reports that several health facilities have begun to detect cases. He joins us via Zoom with details. Grateful that you could find time to join us. Which facilities have you visited and what's the situation there?
3 facilities in the Tamale North constituency. So I visited the Taha Community Hospital or Clinic. I also visited the Kalpohene Health Center as well as the 4 health centers. And the indications are that, for instance, at the Kalpohene Health Center, they started recording cases, suspected cases, as far back as in November 2022. And they have not been able to confirm their cases because really these facilities don't have the equipment to be able to confirm or detect the virus. And so they take samples and forward it to Accra. My checks there tell me that it's been difficult to get results for the tests they took even in November. And so there's some kind of confusion. They are not quite sure if it is actually measles, even though the cases really, the symptoms, the patients were showing symptoms of measles, and they believe that it is measles, but they were just waiting for the confirmation to come from Accra. Unfortunately, for that period of time, they haven't been able to confirm the cases. So health officials there are worried that if the situation continues, it may get worse. The number of cases we are recording here in the Tamale North constituency may get worse if we are unable to confirm the tests that are being done.
Now, you reported the situation in some households. Tell us about that.
Yeah, so I was also at the Taha community. I spoke to a number of people there. Residents say that for a very long time, they haven't reported or witnessed any case of measles in their communities. But in November, December, and especially in January, households started reporting that their family members were catching the measles. I spoke to one gentleman, Salim, who told me that he was actually infected by this measles. In fact, he was in the hospital, at the Tamale Teaching Hospital. He was actually admitted and treated for measles. When he came back home, 2 of his children also caught that disease. And because he told me that when he was at the hospital, they really didn't offer him any treatment apart from infusion. So when his kids also caught that disease, they decided to treat it locally. And hopefully everything is fine with them. But residents are scared. They are worried that, first of all, there are no vaccines across the northern region. And secondly, when you catch measles, health authorities really do not have anything to do or to any treatment measure for you. They just treat symptoms, and the residents think that it's not the best.
So what are health officials saying about the situation in the area?
So I have been trying to establish contact with the Sanargo Municipal Health Directorate. In fact, I spoke to the health director. He referred me to the regional, and for the northern region, that's the difficulty. Anytime you want an information, you'd have to refer to the regional. And unfortunately, we didn't quite get information per se from the regional outfits. They are very tight-lipped on this particular matter. But when you speak to the health officials who are on the ground, the nurses, the midwives, they are able to open up a bit to you. And they are the ones who are worried that if something is not done immediately, we could start reporting deaths.
Grateful to you for joining us for those updates. The Member of Parliament for Tamale North, Al-Hassan Suhuyini, has expressed fear over the possible closure of schools in his constituency following the outbreak of measles and a shortage of vaccines in parts of the country. Now, reports suggest 3 essential vaccines against childhood killer diseases are lacking in hospitals nationwide, putting the lives of babies at risk. A 72 million cedis released to the Ministry of Health for the purchase of these essential vaccines for babies cannot be accounted for. This is despite the confirmation by the National Health Insurance Authority that the last tranche of the money was paid in January this year. Oswald Esfia Mensah is NHIA's acting corporate affairs director.
Well, from the NHIA standpoint, let's understand that we are just payees or payers in the architecture of this vaccines procurement. So once we have made payments available to the ministry, I guess it will be difficult for me to explain why the vaccines have not been supplied. But as I said, of course, you know that our budgets go through Parliament around the same time, which is always around February, March. And once it gets approved, we wait for instructions from the Ministry of Health to release this funding. And this funding, as a matter of fact, goes to the UNICEF. There's a program which this falls under Government of Ghana's co-funding obligations, to purchase these drugs and devices and other commodities. So it comes under the Gavi arrangement. So these payments are actually released to the UNICEF, and between UNICEF and the Ministry of Health would make sure that the procurement of these vaccines are available. I can tell you that we did payments in June, October, November last year, and I think the last tranche must have been paid in January 2023 for that component under support to the Ministry of Health.
Now, the Health Committee of Parliament's request for the Minister of Health to appear before it to answer questions about the disturbing trend on Tuesday was not honored. Speaking to Joy News after making a statement on the floor, Al-Hassan Suhuyini described the situation as regrettable, expressing fears the situation may lead to the closure of schools in his constituency if the vaccines are not immediately made available.
We are having to deal with an outbreak of a disease, not isolated cases of a disease that we should have, completely eradicated in 2020. We are in 2023, and we are dealing with an outbreak, especially in the midst of the concerns that we do not have essential vaccines to deal with it. We, as a country, have developed, a robust system of immunization, and we have become, a case study for our peers in the sub-region when it comes to deployment of immunization. So it is so regrettable that we have all these things in place, but for lack of resources, I believe, or proper planning, we do not have the essential vaccines, and we are, seen a retrogression in the gains that we have made over the years as far as the eradication of measles is concerned. A couple of months ago, the Tamale Central Hospital had to shut down the pediatric unit because of the outbreak of measles. And if care is not taken and this addressed aggressively, we may see the shutting down of schools, very soon, because these children do not even know how to observe some of the hygienic things that they are supposed to observe in order to limit the spread of measles. You are talking about runny nose, and it is usually prevalent with children between the ages of 4 and 14. So they don't even know how to control runny nose and all of that. So if they go to school and they have these symptoms and they have these conditions, you can just imagine how many kids are at risk.
Pharmacist Harrison K. Abutiate is Chairman, Ghana National Chamber of Pharmacy, and he joins us via Zoom now. Grateful to you, sir, for joining. Now, what's your take on this development?
Well, I didn't join you at the beginning, but I assume that you're talking about
the shortage in vaccines.
Yeah, it's a rather serious situation we are in now, because these vaccines are supposed to prevent some diseases, especially in childhood diseases. And honestly, I don't know why these shortages have come about. It could be delay in supplies, or maybe some orders may not have been placed on time, or something else. I don't know. I really don't know. But there shouldn't have been that shortage. Yes.
Okay. Now, so why haven't we been able to start production of vaccines on our own as a country?
It's just because it's not that easy to start vaccine production. But it's a question of deciding what the priorities are. Because, as you know, even in this age that we're talking about COVID vaccine, it's not that easy. We cannot start from scratch. We may have to bring in the vaccine and repackage it here in case of the COVID. With the older vaccines, like the childhood vaccines, normally the WHO and UNICEF who provide some of these as grants and donations, to nations. So it may not have been taken as a serious area to get involved in if you are going to get donations from the UNICEF or WHO. But as things are now, it shows that there are some things that we can get for free, but the others we have to start thinking how we produce them. And the older vaccines maybe are easier to start with because they are urgent. I mean, if your child doesn't get vaccinated like we've seen, and they get measles or polio or any of these childhood diseases, then it's a very serious situation the nation is dragging itself into.
Now, since this is a capital-intensive venture, like you state, can't 2 or 3 companies collaborate and achieve this?
Well, in Europe and advanced countries, yes, there are collaborations like that going on. Unfortunately, we don't have such collaboration among our manufacturers, except recently when we talked about the COVID vaccine. And like we said, it's not that easy to start vaccine production. It's a very skilled area. And some of the skills required and the quality control issues that go on need to be done and practiced properly. Otherwise, you are going to introduce other contaminants and start something else. Yes.
So What's the latest on the Vaccine Institute, and will it change the narrative?
Oh, yeah, definitely. Once we have an institute that is producing vaccine, we can introduce the others. And to me, then would have had the personnel, would have had the facilities. And if we are producing enough, we could bring down the cost of production. And that would be helpful. In fact, we should be thinking of producing the basic products, not only vaccines, but even basic drugs. You know, as COVID has shown, you can't depend on other countries. So we must try to support the production of basic drugs, basic vaccines. I mean, we have malaria prevalent in this country. It's only now we've started malaria vaccination or doing the trials. And it's possible that if we do well in this area, it could be a way of maybe exporting to other countries that have malaria. But Europe, they don't have malaria. So maybe they're not very keen to do anything about it except to export it to developing countries like ours. Yes.
Okay.
Yes.
Now, with your experience, where do you think we have to start from if we are to start producing our own vaccines?
Well, stage one is what we are doing. We've started an institute. We have to train the people. We have to have our priorities. What vaccine do you really want immediately in the system? And like we said, the childhood disease vaccines are important. Then the malaria, malaria vaccines are important. Anti-snake vaccines should be one of the priorities also. And of course, the COVID has now come. So it's a priority also now. But it's sad to see children who maybe because there's no vaccine for them, they develop polio, and they have to go through life for the rest of their lives paralyzed. You know, so that's we must just identify the key areas that are important for the nation, and then go into the how you can produce some of these vaccines in those areas. Yes.
Grateful to you for joining us now. To other stories, residents and commuters along the Tema Highway called for the eviction of heavy trucks that have turned the Tema toll booth area into a parking lot, obstructing the free flow of traffic. Now, some of the residents say they have observed an increase in road crashes on that spot. With no space at the Tema Harbour, some of the drivers say they are left with no option than they park there while they wait for their documentation. Michael Ashley has more in the following report.
Heavy-duty trucks line up the shoulders of the highway, running as far as the eye can see. According to some of the drivers, they have no option than to park here while they wait for documentation for their cargo. Akwesi Techi is one of such drivers.
In the port, if you load, there is no place for you to park again. There is no parking place from Tema to this place, and even from this place to Achimota or something, there is no parking place, the place where we can find a comfortable place to park. And our papers too haven't ready yet. So unless you find some place to park so that when your people come, then you go. But apart from this place, there is no place for us to park again. That's why we are always parking here.
Their presence here only exposes many motorists to untold danger, and some of the truck drivers even agree.
We know that we are disturbing, but we don't have any option.
While waiting for their documents, some drivers inspect their vehicles and others simply use the time to rest. Some of the drivers explain that some agents at the Tema Harbour offload their cargoes onto their trucks to avoid paying demurrage at the port. While parked there, some drivers say they are harassed by some city authorities. Al-Hassan Tahiru is a victim.
Just yesterday, they come, I wasn't inside the car. They just come and opened my gate and they took my key.
For what exactly?
They said we should yes, we have no option to park here, so we're supposed to live here. We're supposed to park our cars and go. And when they came to my car, I wasn't there. They just opened the gate. They took the key. I don't know where they have sent with the key.
More drivers report same. They say it only prolongs their illegal stay at the site.
Yesterday, I was there. When I started the car to move, he said that I shouldn't move the car. He off it and removed the key. And said, I don't know where he's sent the key. Yesterday he came there and said that he's going to lock the car. And I said no. Then let me move the car. He said no, I shouldn't move the car. And off it. When I started, he himself climbed and off it and remove the key and go. Why? And we don't know where he sent the key. So if we are even ready to go, we can't go. So if my car cause accident now, it's you who rather cause the accident, not me.
I'm there and the police people came. They came and told me that I should move the car away. I'm even ready to spark it and they said no. They have arrested me, so I have to pay before I go. And I say, oh, I have nothing. I've been here because of money. I have nothing here, that's all. So they should just give me a little time. If I get to the edge, if anything, I'll confirm. And they took my license and my car key. They went with it. I don't even know where they are now. I don't even know.
So what are you going to do now?
So right now I'm just waiting for them. If they come, alhamdulillah, I will find a way that I will do and get my key. But the money that they say I should pay, I bet if I get the money, I'm not going to pay.
And the true matter is that the whole Tema, first Tema was sweet, but now Tema is not good again. When you park at Tema, anywhere you park, Tema Gapua, let me say, Habwan Gapua, they will come and lock your car.
But not everyone agrees with the drivers.
The parking place is small. But from there to the Bognaza there, if they not park there, it's good because that place is causing big accidents.
He only gave his name as Nathaniel. He observed that the number of accidents around the toll booths have increased since the trucks started parking there. He says the drivers must be forced to evacuate the shoulders of the road.
To take over this situation for toll booths here. People was this that here is plenty people. Because of this parking of the drivers, then parking for the toll booth. So if we give him there some place, let's give him another place to go and park. Because last year, almost about, since the time they blocked toll up to December of last year, almost about 90 people was dying here.
Nathaniel says the local authorities are yet to respond to his many appeals.
Why? Come and see Bola for the back here. So many Bola. I went to Ashama Municipality, AMC or CPP or say, oh, why? There. You throw me away to tell me that I should go police.
But the drivers insist if they had an alternative, they would have moved.
We are not here for fun. We are just not here for fun. If we have some place to park, we will not even park here. Say that they should talk to the Gapore people. Okay. The time that they will release us at the Harbour place, they have to make sure that they give our papers, our advance. If I get my money and my papers, there is no need for me to come and park here again.
So all of what we need is before they can ask us not to park here, government have to find a place for us so that even, I don't know, other Tema or this place, they should find a place for us. When we park, we finish, we'll go and park there. And we will not find difficult to pay the money that they will be correcting that.
While local authorities take their time to react to this growing concern, the menace continues to fester. For Joy News, Michael Ashale.
Now let's stay a bit longer on this development. Joining us now via Zoom is General Manager, Marketing and Corporate Affairs at the Ghana Ports and Harbours Authority, Esther JB Donko. Grateful that you could join us now. You heard in our report from some of the drivers who lay the blame solely at your doorstep. Now, how do you respond to that?
Thank you for the opportunity and good evening to your viewers. I was tempted to tell you that they are lying, but let me explain. The one on the documents are not ready. The transit cargo will never be released for them to even get to motorway if they have not completed their documentation. The risk of diversion for transit is very high. So we make sure that we provide a yard which we call the transit yard, for them to park after loading, for customs to complete the customs documentation, fix the tracking device, and then they are released in the system, and GPHA gives them the waybill. They move from the yard. Once they move from the yard, it is assumed that all documentation is completed, and they have to go to the border. Because of these, their delays, parking around, mainly for the fact that they have to be giving some advance payment for fuel and others before they leave. Customs have even come up with a number of days that they are expected to be at the border. They've been given, initially they were given 7 days, and then they pleaded that the 7 days was not enough. They've been given 10 days to show up at the various borders, Paga and Hamele. And if they fail to show up on the 10th day at the border, they are charged 500 per day, per the extra days that they have spent. So it is not true that documentation is not ready and they have been released. I don't know what else documentation they will be working on, but obviously it is not the port and customs documentation at the port. It is not true that we have not provided a yard for them to complete this documentation. As I said, after loading in the port, we have a yard called the transit yard. They park there, complete the custom documentation. We give them 48 hours. And sometimes when they are done with the documentation and they still, some of them still stay in our yard, we try to charge them to deter them from staying there because we expect them to move on. The more the loaded truck, transit loaded truck stays in the port environment and the cities, the more risky it becomes for their monitoring. So we don't even want them to stay around. We have a truck park for empty trucks for them, so that when they come from their various countries, Burkina, Mali, and Niger, they have a place to park and wait for cargo to be loaded. But once they are loaded, we expect them to leave. And so they are not expected to park around. We have had several meetings with them. We have told them that they need to take the advance payments from the importers before they even come to the port. So, but I don't know what the problem is.
Okay.
Yes.
Now if you look at the report we brought you, one of the drivers was saying that they are not willing to pay the charges that you do give them when they park in your yard. Now, to solve all of this, what is the GPHA going to do about this situation to ensure that we reach an amicable solution?
No, we don't. The bottom line is we don't expect them to park after loading. You have completed every documentation and you are supposed to move to the destination of the cargo. So we don't want to encourage them parking around. Once the customs tracking device is fixed to the loaded cargo and truck, we expect them to hit the road and leave the environs. So what we've been doing is to talk to them to make sure that the advance payment that they need, they have it before they even go into the port to load. Because like I told you earlier, we have a parking truck park for the empty trucks. When they arrive from their various countries, we have a place for them to park. Some even spend 1 month, 2 months, 3 months at that yard.
Okay.
Have not a big deal. But once you are loaded and you have been released with full documentation, before we release you from our yard to hit the road, we don't expect you to park just close by at motorway. Probably, if they move on and travel the way along the routes and they are tired and they need to rest, that's fine. But moving from the port and parking at the motorway is a no. So we have always encouraged the police to deal with them.
Grateful. Thank you so much for joining us. Now, you're still watching the Joy News Prime. Still to come here. Ghana demands experience, not experiment. Former President John Dramani Mahama lashes out as he officially launches his campaign bid for re-election.
I've searched my soul and place close attention to your voices, to your daily struggles, and to our present national predicament. At this stage, Ghana demands experience, not experiment.
Welcome back from the break. Now, Ghana demands experience, not experiment. Those are the words of former President John Dramani Mahama as he officially joined the NDC presidential race. Addressing members of the party at the University of Health and Allied Sciences in the Volta Regional Capital Hall, the former president said the country is at a crossroad and requires a bold and decisive leadership capable of rescuing the country from what he describes as the cluelessness of the NPP government.
Officially joined the race to contest for the flag bearer slot of the National Democratic Congress. For the 2024 elections, which are considered to be the most important and defining poll of our time, I've not taken this step lightly. It has been the product of months of prayer, broad consultation, and sober reflection. I've searched my soul and place close attention to your voices, to your daily struggles, and to our present national predicament. At this stage, Ghana demands experience, not experiments. Ghana demands togetherness and not divisiveness. Now is the time for bravery of heart and clarity of purpose. 6 years ago, despite our best efforts, the people of Ghana decided to entrust the management and administration of this country into the hands of the NPP. They did so in the hope that the many mouth-watering promises that were made to them would translate into meaningful action that will mark an improvement in their living conditions and the general well-being of our country. My brothers and sisters, 6 years on, those hopes have been dashed. Instead of the prosperity and progress that was promised, the last 6 years have been perhaps the most difficult and challenging period of our history as a country. This government has been clueless and in many ways callous.
Now, describing the country's economy as broke, the former president accused the government of acting in bad faith in the domestic debt restructuring program.
The unthinkable has happened, and our country today is broken on all fronts. Ghana is bankrupt. We are saddled with debts we simply cannot pay, and we have suffered the global humiliation of defaulting on our debts and being downgraded by all credit rating agencies to the lowest level ever seen in our history. Our economy is in the worst ever shape, with suffering and pain on an unprecedented level. Hyperinflation and ever-increasing price of basic items, including food products, have all combined to inflict unbearable pain on millions of Ghanaian households. Parents are being forced to make the choice between seeking prompt health care for their sick children or providing meals with their meager resources for their families. Our middle class stands the real risk of being wiped out on the back of an obnoxious debt restructuring program. The poor who depend on the middle class for employment and sustenance are on their own and uncertain of their fate in the future. Our aged pensioners and the elderly have not been spared either. In the past few weeks, they have been compelled to stage public manifestations outside the Ministry of Finance in defense of their livelihoods, even in this elderly state. Who would have thought that Ghana will come to a juncture like this?
Now, two NPP MPs have described as empty former President John Mahama's bid to lead the country again. In the Volta region today, the former president launched his campaign for the NDC flag bearership and, among other things, promised to run the country with no more than 60 MPs and also to scrap S. Gracia. But MP for Sefia Kontombra Alex Tete and MP for Doma East Paul Chumberima say the former president has nothing more to offer Ghanaians.
John Mahama coming back is an old story. It's not a new story that Ghanaians should be thinking about. John Mahama is saying that he's come to repair Ghana. Actually, no one from the MPP is saying that Ghana is not facing the challenge. We know we have economic crisis, but I have already been saying that it's better for Ghanaians to be in MPP government than to be an NDC. John Mahama is telling Ghanaians that he is coming to change Ghana. We are all in this country when John Mahama, as a president, couldn't even pay teachers' allowance. But Ghanaians know what John Mahama did for Ghana. And I don't think he's bringing any new ideas. That's the old story that he's come to repeat. He has an opportunity to rule this country for 8 years. Just 4 years, he couldn't manage Ghana, providing 24 lights for Ghana. He couldn't. And today he's telling us that he's bringing a new ideas. What ideas again John Mahama is bringing to Ghana? Come and repeat the doomsaw? Scrap the nurses' allowance, teachers' allowance?
It's not a new phase. It's an old wadi, as they say, that we know. And so I think, and it's not news because everybody knows that NDC at this point believed and hoped that it's only John Mahama that can salvage their party for them, and their hope was banked on him. So clearly, it's not news to us for us to be surprised that John Mahama has once again launched his campaign.
But are you afraid? Are you afraid that John Mahama is coming?
Afraid of John Mahama?
Maybe he's the biggest impediment against you breaking the 8.
I mean, what? You see, he was a vice president. He became a 3 months or so or less president. He became a 4-year president. What did we see?
Now, the National Health Insurance Authority has set up a committee to regulate tariff regimes of private insurance companies in Ghana due to the lack of uniformity in the tariff structure. That's according to the Director of Private Health Insurance at the National Health Insurance Authority, Hudu Issa. Speaking at the 10th anniversary of the Apex Health Insurance Company in Accra, Mr. Issa revealed that the uniform tariff regime, when implemented, will go a long way to improve the operations of private health insurance companies as their services are indispensable. There's more in the following.
Insurance companies face diverse challenges in Ghana. Topmost of the challenges is the issue of the varied tariff regulations. This has put them at the mercy of private health providers in terms of tariff regulation. The Director of Private Health Insurance at the National Health Insurance Authority, Hudu Issa, in an interview with Joy News, indicated that the Health Ministry has established a committee to oversee private health insurance companies in Ghana's tariff structure.
Currently, private health insurance companies, the outstanding challenges I see them facing is what we call the tariff regime they are using. Now, all private health insurance companies, they are at the mercy of the health provider. As and when the health provider feels that I should increase tariffs, they increase. So that is one of the major challenges that the industry is facing. And so the authority as a regulator is venturing into regulating this space for the private health insurance company. We are at a stage where a committee is formed by our indefatigable Chief Executive, Honorable Dr. Bernard Okuboy. The committee's mandate is to formulate and develop uniform tariff structure for the private health insurance schemes.
He says Apex has greatly aided the National Health Insurance Program.
Apex is a private commercial health insurance scheme. The government is not oblivious of the fact that governments of countries cannot attain the universal health coverage all alone unless a room is created for private partnership. So Apex is contributing in attaining the universal health coverage.
The Chief Executive Officer of Apex Health Insurance, Godwin Fafasi Chufie Tokwenyi, said his outfit is aimed at working to make Ghana healthier.
The main objective for any health insurance business like ours is to make sure that we secure healthcare services for our insured members, and which we will continue to do And like our team is working together to make Ghana healthier, which we've been doing for the past 10 years. I think for now we have a number of hospital projects. We have plans presented to the board to acquire shares in some existing facilities and also to set up new ones, also to expand our telemedicine and also our medicine delivery program, which is going on well. It brings convenience to our members. You can imagine sitting at home and then you have a prescription and then you have to go from one place to another to get such medication, and then at the click of a button, the medication is delivered to you in 30 minutes, 45 minutes without you having to go through stress in trying to get this medicine.
Some clients and staff of Apex share their experiences.
I'll start from the staff, very energetic, very talented, interesting characters, contributing to the growth as we speak now, and it's very interesting to see us, working together to make the company grow, so it's been very wonderful.
It has been an amazing journey so far. We joined in 2015 and all through to 2013 we've had prompt services. We haven't had any issues with any of the healthcare providers. Prompt payments when we have to make our reclaims. It has just been an amazing journey.
Apex Health Insurance, the multi-award-winning insurance company, has contributed immensely to the national insurance scheme in a relatively short time. Jesse Sawabuafo's reports read to you.
As we're watching Journey's Prime, we'll take a break. We'll bring you showbiz. Stay with us. All right, so welcome back. Time for us to bring you showbiz. Unlike today, I'm not starting.
Hello to you, Brace. It's a beautiful Thursday. Today we're going, faster than usual. Let's talk about Clemento Suarez, because he's been opening up about his life as a comedian and also the sector as a whole. According to him, the comedy industry is lucrative, depending on the way one sees and experienced it.
But Clemento, is it a lucrative industry?
Yeah. Oh, they've made money. As for that one, yes. Yeah, it's very lucrative. It's very lucrative, but you see, real estate's lucrative. But when you're being told diner, you can't make the money.
Yeah.
So the lucration there is there, but to get it to be lucrative, it's you yourself.
Clemento Suarez right there. So my colleague Ibrahim Bembako went out last night and he's been doing a lot of things. There was a launch of something very beautiful at Purple Pub, and so he comes out with this report.
2, 1, let's go!
It was a night of fashion, music and dance at the combo launch of the Guinness Bright House Experience train and the Ebosso promotion by Guinness Ghana at the Purple Pub in Osu.
You get to win airtime, you can win 5,000 Ghana cedis cash. Yes!
Award-winning fashion designer Abrante the Gentleman showcased some designs on the stage.
Whoa! Whoa! This is beautiful. Please give it up if you're loving the designs. And of course, this is what we got to see on the stage tonight. Beautiful display by Abrante the Gentleman.
Incredible Ziggy and his dance crew, Afronita and her girls did what they do best with spectacular dance moves. And musician LaRusso did not fail to excite the crowd with his performance. Papa say the brand manager spoke about the Guinness Bright House experience and the Ebosso promo.
So the Bright House is a flagship of Guinness where we go around and we using our passion points of Ghanaians and the brand, football, fashion, music, dance, to bring some excitement to lives, add a dash of magic to people's lives. And we
Congratulations to Michael B. Jordan. Today is Throwback Thursday. I have a picture for you. Yes, gospel musician MOG. Do we have the picture?
Oh, I thought you.
Oh, yeah, that's it. So he's celebrating 10 years of marriage to his wife. Beautiful picture.
Oh,
so
that's sweet.
The difference. So we have.
We should be congratulating the. Look at me. We should be saying kudos to the wife.
Yes,
because look at him.
For support.
Very slim. But today, look at what you see there.
So congratulations to you.
Okay. All right, thank you. I'm grateful.
Remember to brush your teeth before you go to bed this evening. And brush tomorrow morning.
When you are up.
Yes.
And do that with Pepsodent. Like Pepsodent Triple Action. Or the Pepsodent Cavity Fighter, Pepsodent Charcoal, or Pepsodent Herbal, because with Pepsodent, every smile matters. Thank you for your company. There's more news on myjoyonline.com. Mami AC Thompson is coming up next with Prime Business. Thanks for your company. Good evening.
You're confused.